Back. According to the Centers for Disease Control, 1 in 5 children in the United States have a diagnosable mental health condition. And CHKD here in town is reacting to this by expanding its pediatric mental health services. Here to tell us a little more about it, CHKD pediatric psychiatrist Dr. Peter Dozier, there on the right, and CHKD pediatric psychologist Dr. Diana Schofield. Appreciate you both being here.
Thank you.
An important topic we have today, and tell us a little bit about the expansion going on in this program at CHKD.
For the next 4 years, we are developing and planning a continuum of care to range from outpatient mental health services to inpatient acute mental health services, integrated with our community pediatricians and our pediatric specialists.
Doctor, what's the goal of expanding this program?
To increase access for families, which is tremendous. You mentioned 1/5 of the children will have a diagnosable mental illness, but only 1/5 of those will be able to access care. We'd like to expand those numbers in the Tidewater area. Families go through a lot to try to get mental health care. It's very frustrating for them. We're planning a significant expansion in a thoughtful way, and having a lot of people both within our health system and in the community contributing to this project.
Diana, we were talking about this is quite an ambitious take on for CHKD.
Yes.
How so, and what do you expect the next 4 years to be like? I imagine it's a large group effort.
It is a large group effort, and we're marshaling a lot of resources and a lot of input from our patients and families, from our community stakeholders and partners, and we're going to move towards a capital campaign effort as well, which will help support this expansion.
Okay. Particularly, we're talking about mental health diagnosing it in youth today. I imagine early detection is very important in treatment, so can you just elaborate on that and how this will help with that?
So early detection takes two forms. One is early detection in the course of an illness has much better outcome than later. And the other form of early detection is really early in development. So we will be, as we are now, but expanding these services tremendously for preschoolers. If we can identify those at psychiatric risk and intervene before the appearance of significant symptoms, their childhood and adult course will be significantly better.
Okay. Again, the number from the CDC, 1 in 5 children in the U.S. having a diagnosable mental health condition. So very important work you all are doing at CHKD, and we appreciate you both being here.
Thank you.
Thank you.
And we'll be right back.